Welcome to the conference session titled Fatigue Management and Exercise. This will be an interactive session, so be ready to participate. Thank you so much for joining us. My name is Nyari, Patient and Professional Programs Coordinator at AMDS. And as we get started, AMDSIF would like to recognize the generosity of our corporate sponsors. At the diamond level, we have Alexion and Novartis. At the gold level, we have Apellis and Genentech, as well as the generous support of our patients, families, and caregivers for supporting our conference today. Immediately following the presentation, there'll be a question and answer session. When asking your questions, please wait for the microphone so that the people online can also hear what is going on inside the room. If you are participating online, please type your question using the Q&A button on the bottom of your screen. We will do our best to get to everyone's questions. When asking your questions, please do not share any private health information, as our speakers cannot answer any questions directly relating to your healthcare. Our specialists today are Tim Pearman and Jenny Finkle. Dr. Pearman is a professor in the departments of Medical Social Sciences and Psychiatry and Behavioral Sciences at the Northwestern University Feinberg School of Medicine. He is a board-certified clinical health psychologist, a fellow of the American Academy of the Clinical Health, and director of the Supportive Oncology Program at the Robert H. Lurie Comprehensive Cancer Center. Jenny found her love for yoga in 7th grade after reading an article in 17 magazine. She holds many certifications, including specialized training from Duke Integrative Medicine in Durham, North Carolina, Yoga of Awareness for Cancer, and patients who practice yoga report positive effects on numerous symptoms associated with both the disease itself and traditional treatment side effects, such as pain, fatigue, sleep disruption, stress, and depression. With that said, please help me welcome Dr. Pearman and Jenny.
Thanks so much for having me. It's good to see everyone. I'm going to kick this off. I'm going to take the first half of the presentation, and then I'm going to hand it over to Jenny to get us moving just a little bit in here. Okay, so here's just a few of the areas that I'm going to cover. And I'm going to obviously run through some of these in terms of like the emotional wellness pieces a little bit quicker so that we can spend the majority of the time on fatigue management, since I think that's something that is sort of under focused on when you're facing some of the disorders that we're talking about today. So just in general, some ways of managing anxiety and stress. I think everyone will agree that spending a lot of time going down the Google rabbit hole can be very anxiety provoking when you get your diagnosis and when you're looking into treatments and prognosis and survival times and all those things. It can be a really scary world out there. The second thing is, I think when you have a diagnosis like this, it's really easy to sort of think, well, there's something wrong with my body, so I might as well just kind of give up on managing that. And that's far from the case. And we'll talk a lot more about that as we go through this. But the stress of receiving a diagnosis like this can have a huge impact on energy level, heart rate, breathing, and some deep breathing and meditation techniques can be really helpful in managing some of those things. We'll talk a little bit, just a very little bit about diet. I'm certainly no dietitian, but we'll talk a little bit about diet and how that affects fatigue. And then sleep. People, a lot of times we don't really think about sleep as impacting our fatigue, but of course it does. If you're not sleeping well, then you're going to be a lot more fatigued during the day. Sorry about this. There we go. So I am a clinical psychologist by training. So I want to spend just a minute talking about managing anxiety, stress, depression. It can be really difficult. And I think probably everyone in this room can talk a little bit about how challenging it can be to share some of your fears with your family members, with your friends, with your closest social connections. Because a lot of times we feel like I'm just going to keep my worries to myself. I don't want to burden my partner. I don't want to burden my kids with my fears. But increasingly, if you feel that way, it's a lot easier to find psychologists, therapists, social workers who you can kind of open up to and talk about some of your stress and anxiety and figure out some solutions to that. Telehealth has become a huge thing, and I think that's definitely here to stay. So, if you're getting treated at University of Chicago and it's kind of hard to get into the city of Chicago because you may live in the suburbs, those kinds of things, you can easily find a telehealth provider that can help with some of these things. And in fact, probably I would say greater than 50% of my practice, I'm at Northwestern, is telehealth at this point, and it has continued even after COVID went away. Um, the third thing I will say is resilience. Resilience is definitely a learned skill, and I know everyone in this room has undoubtedly felt weak, felt scared, felt sad, depressed, and haven't felt very resilient. But I would bet if we kind of took a poll and had some of your family members talk about you, I bet every single family member in this room could give an example of some resilient behavior that you have implemented. So give yourself permission to feel sad when you're sad. Give yourself permission to feel worried when you're worried. Don't fall into the kind of toxic positivity message that you get a lot of times where people are saying, you're a survivor, you've got this, you're going to get through this, everything's going to be fine. I had a mentor who was at Sloan Kettering named Jimmy Holland, and she wrote an article at one point that was called "The Tyranny of Positive Thinking." And I love that because, her point in saying it was the tyranny of positive thinking was that everybody gets this message that you've got to stay positive. You're going to get through this. You're a survivor. And it leads to people feeling, quite frankly, guilty that, why am I not coping better? I have times when I feel really sad or really scared about the future. And she said it's completely unrealistic to think that you can be diagnosed with a potentially life-threatening illness and just cruise through and never have times when you feel down or upset or scared. But the way that I think we can sort of stay positive and do that in a good way is essentially to kind of separate things. And this is a broad overgeneralization, but to separate things into two piles: the things that we can potentially control and the things that are out of our control. So things we can control are things like exercise, diet, making it to our appointments, doing what our medical professionals tell us. The things that are out of our control are things that we all worry about. Where is my health going? Is the disease going to progress? What kind of side effects am I going to have from treatment? Those kinds of things. But I think what we want to do is really push those things to the side as much as you can. Doesn't mean that you're in denial. It doesn't mean that those things don't pop back into our minds from time to time, but you really want to focus most of your time and energy on that controllable pile. And as much as you can, just kind of push that to the side. And again, a lot easier said than done. But I think, broadly speaking, the folks who learn that resilience are the folks who are the best able to do that. So we'll move on now to fatigue, where I want to spend most of our time. Fatigue is the most common symptom far and away in all hematologic conditions, both benign hematologic conditions and also heme malignancies. So the NCCN gives this definition that you see here, but interestingly, even though there are standard of care recommendations that the NCCN has come out with to manage fatigue, it's very often overlooked. So I don't know how many of the folks in this audience have had your hematologist talk to you specifically about fatigue, but a survey we've known for 30 years that most oncologists believe that pain is a much more important symptom than fatigue, even though pain is much less frequently experienced than fatigue. And so the discussion between the oncology team and patients and families about fatigue is just very often not a conversation at all. So the prevalence of fatigue ranges anywhere from 60 to 90% of folks who undergo treatment for hematologic conditions. And interestingly, we don't really know in a lot of cases sort of the mechanisms behind this. Why do people experience fatigue? So sometimes it can be obvious. A lot of the chemotherapy agents that we have, we know the kind of the biologic mechanisms for fatigue, if they cause a lot of anemia or those kinds of things. But interestingly, people who have solid tumor malignancies and get surgery only for their cancers, they also have a really high level of fatigue. And there doesn't seem to be any biologic reason behind that. So is it the stress of the diagnosis, worry about the future, not being able to sleep? who knows? But that said, there are, quite a few things that we can do to manage fatigue. So to start, it's really important to rule out a ton of factors that can contribute to fatigue. So getting, and obviously, once you get the diagnosis, you will be under a very watchful eye of your medical team. But it's really important to, make sure that you have a primary care doctor as well that can check for things like thyroid problems, check your cardiac functioning, because some of the chemotherapy agents can affect your heart, kidney problems, low blood counts like anemia. There can be a lot of medication side effects, either from chemotherapy or other medications that we're on. And then again, diet and sleep really impact this as well. So it's really important to get kind of a head to toe assessment of all of the sort of medical variables that can contribute to fatigue. And then you can kind of go on to these things that are a little bit more controllable. So again, I'm not a dietitian, but this is the American Dietetic Association suggestions for what a healthy diet should be. And, this is fine. I guess it's helpful, but I have always said, if you come from a family like mine, a very Southern family, my wife, who is a vegetarian, jokes that before she showed up on the scene in our family, we could go an entire weekend without having one meal that didn't have bacon in it in some way. So I think, in saying that, like, these recommendations are great, but if you come from a family like mine, they may say, okay, so I'm supposed to limit my red meat. Well, okay, I'll only have 2 meals today with bacon and not 3. And it kind of misses the point. So I say that just to say, hopefully, wherever you are treated, they will have an oncology dietitian on staff. And I would absolutely take advantage of that. And even if you are treated at a center that doesn't have a dietitian, I think it's really worth, just even if you have to pay out of pocket, it's really worth seeing a dietitian. I can tell you that I have learned more from our oncology dietitians than I've learned from almost any other provider outside of my discipline. So they are really knowledgeable and can really help sort of operationalize these recommendations. So we'll move on to depression and anxiety. The depression and anxiety, not surprisingly, are exceedingly common when it comes to all hematologic and oncologic diagnoses. Depression and anxiety occur in upwards of 30% of all of our patients. So this is my whole practice, is seeing folks for psychotherapy and counseling. But there are a number of different approaches that are very successful. So, the downside of this is over 30% of people experience depression and anxiety. The plus side is depression and anxiety are very, very treatable, and very treatable in a way that can be very individualized. So some people say, I'm on enough medication already. I do not want to add any more medication. I don't want to take another pill every day. So those people come in for counseling. They come in to see me. But other people will say, it's too much of a hassle. I'm not really comfortable opening up to someone. I don't want to really talk about this. I just want my mood to get better. And for those people, antidepressant medications are well tolerated. They have good efficacy. They're kind of once a day pills usually. And don't have very many side effects at all. So it can really be an individualized treatment depending on kind of what you're comfortable with. And again, there are a number of different antidepressant classes, and within those classes, there are multiple antidepressants. So even if the first antidepressant that you tried doesn't work, there are tons of other options, and these medications are pretty easy to get onto and off of. So you definitely can try a few if the first one just doesn't nail it with the symptoms. Same is true of the anxiety medications and also counseling for anxiety. So there are also some medications specifically kind of targeting fatigue. But as you can see, a lot of these medications have some pretty nasty side effects. So, psychostimulants, those are things that are often prescribed for ADHD. So they're kind of amphetamine-based medications. And obviously the downside with that class of medications is if you keep taking them over time for fatigue, your body develops a tolerance to them. Then you have to take a little more to get the same effect. And then over time, you have to wean off those really slowly, and they can be kind of difficult. Steroids, anybody who's taken steroids probably knows they give you a pretty immediate boost in energy, which is great. People love steroids for the first few days they're on them. But then, a lot of times people kind of have a crash with that, and they have difficulty with feeling irritable, with not being able to sleep. And then again, those are sometimes kind of difficult to wean off of, and you have to wean off those with a really long tail. So, the medications for fatigue, I would say, are not the first step in managing fatigue. I would say these other kind of more behavioral techniques are probably better. There are also some sleep medications, but again, have some downsides. The benzodiazepines are medications like Ativan, some of those medications, Valium, that you've undoubtedly heard of. But again, your body develops a tolerance to them over time. So you have to take more and more, and then you have to wean off them really slowly. And that can basically result in some rebound insomnia, where you have a few days of just being up all night. So there are also some non-benzodiazepines, things that you've probably heard of, like Ambien. But again, most physicians don't really want to put people on those long term. They're more for, occasional sleeplessness is the way that the FDA thinks that they should be treated. So sleep hygiene, that's something that I work with my clients on a lot. Sleep hygiene is basically a behavioral way of managing sleep. It is very well proven to be effective. But I always tell my patients when we're starting this, I want to be very upfront with you. Sleep hygiene is not easy. It requires a commitment on your part. And the first few nights of this are oftentimes pretty brutal. So some of the things are pretty easy for most folks to do. So avoiding caffeine after noon, not too hard. Avoiding smoking, drinking, eating heavy meals, a lot of exercise within 2 hours of bedtime. Pretty easy for most people. The thing that is really difficult for a lot of people is when you're having clinical insomnia, you're really not supposed to do anything in your bedroom except have sex and sleep. And that includes everything. So for people that don't have insomnia, it's not a big deal if you occasionally watch TV in bed or if you read in bed, because it's not really affecting your sleep. But for people with insomnia, what's happened over time is that for those folks, the bedroom has become conditioned to be kind of an anxiety provoking place, because as bedtime rolls around, you'll start to think, oh boy, I got to go to bed. But is it going to be like last night when I couldn't get to sleep? Or am I going to wake up in the middle of the night and be up the rest of the night? Like, what's going to happen? And then your heart rate goes and your thoughts are racing. And then you're in no condition to sleep. So what you're trying to do with sleep hygiene is to retrain your body to view the bedroom as a place of rest, relaxation, comfort. And so for a lot of people, that's kind of difficult, using the bedroom only for sleep and sex, because you're used to reading in bed, or you may be used to watching TV in bed. The other thing that makes this challenging for a lot of people is this 15 to 20-minute rule that I mentioned. And what that means is you're supposed to pick a bedtime, and it should be the same bedtime every night, including on the weekends when you're not working, when you're on vacation, same bedtime. So you train your body that as that time gets closer, your body starts to kind of shut down and feel sleepy. And then you go to bed, you give yourself 15 to 20 minutes. And if you're not asleep during that time, you actually get out of bed, leave the bedroom, go to another room in your house or your apartment, and do something else until you're sleepy again. And then you repeat that cycle. Get back in bed, 15, 20 minutes. If you're not asleep during that time, you get out of bed, leave the bedroom, go somewhere else in your house and do it again and again and again and again. And that's really the hardest part of this, because first of all, that puts sort of a timeline on it. And a lot of times that makes people a little anxious at first. But again, what you're trying to do is you're trying to retrain your body that the bedroom is a place of comfort. So you don't want to just stay in bed and gut it out and think like, oh, I just got to get to sleep. I'm going to close my eyes. I'm going to try again. I'm not going to do it. Because again, then you're making your body think that the bedroom is kind of an anxiety provoking place. So this really works, but it does require a commitment up front. And a lot of times, I'll tell people how to do this, and they'll show up the next week for their meeting with me and give me the side eye and say, this is the worst. I hate this. But eventually, after you do it for a week or a little bit more, it really does start to work. And for a lot of people, what ends up happening, quite frankly, is that the first few nights of this, they're up and down and up and down and up and down. And then finally, they just crash. And that sort of resets your clock, resets your circadian rhythms, and then you're sort of better able to sleep. So there's also some promising research when it comes to fatigue on bright white light therapy. This is something that's been touted for probably decades, but it's never been specifically tried in hematologic disorders and oncology. That changed about 10 years ago. Bill Redd at Sloan Kettering and Mount Sinai started doing this with breast cancer patients initially, and it's now expanded to some of the hematologic malignancy patients and other studies. And it's been found to be really effective. And you can, by the way, you can also buy these bright white light devices on the internet. They're everywhere. So, and they're inexpensive. The treatment is, as far as we can tell at this point, it's still pretty early stage, but you're supposed to put this bright light by you for 40 minutes a day for a month. And you can do that in any way. You can do it while you're working at your computer. You can do it while you're watching TV. You don't have to do anything. You just have to be close enough to the light that it actually can penetrate your eyes. And this has been shown to be pretty efficacious in oncology patients, and it seems to improve sleep and energy and mood. So worth a try. The other thing that some people find helpful is keeping a log of problematic symptoms and sort of trying to understand the patterns of when am I the most fatigued? And do I have the most energy in the morning? Do I have more energy in the afternoon? If I'm napping, when am I napping? And is that helping? Is that making me feel rested? Or do I wake up feeling just as fatigued as I did before I napped? And in doing this, you can kind of over time find some ways to manage the fatigue that you're experiencing. So if I find that my morning time is the best time, then maybe I'll top load all the things that are important for that day. If it's grocery shopping or doing work, I'll do it then because I know that the afternoons are going to be a little bit rougher. And so some people find this really helpful to kind of identify patterns. So we'll move on to exercise because exercise is, again, the most strongly supported behavioral intervention for fatigue. None of the other interventions work as well as exercise does. And obviously, I'll give the caveat that it's important to consult with your medical team or a physical therapist to make sure that you can do whatever exercise you decide that you want to do. The Surgeon General recommends 30 minutes of moderate activity every day. And if you think of moderate activity, that's if we talk about walking, that's not walking like when you're walking your dog where you're not out of breath, your heart rate doesn't really go up, you're not really exerting yourself. So you should notice when you're doing moderate activity or moderate walking that your heart rate may go up a little bit, you may be a little bit out of breath, but you're not so out of breath that you're like, oh, I can't do it anymore. And the good news about exercise is, you don't have to join a gym, you don't have to pay for P90X. You don't have to do any of that stuff. It's really easy to find senior centers, churches, cancer support communities. Like in Chicago, we have Gilda's Club, we have Living Well out in the western suburbs, and they all offer free exercise programs that in most cases are hybrid. So you can actually do them in person or you can do them virtually by video. So it's really easy to find exercise options that don't cost anything and don't require a trip into the city. So I have to give a photo credit to my lovely wife, Jenny, and my dog, Clementine, for this picture. So some of the parameters, when I work with people to increase their exercise, so people that are pretty sedentary and don't have any kind of an exercise plan or haven't done a lot of exercise before, I recommend that people start with about 10 minutes of exercise for the first week, 3 to 4 days a week, and then try to increase that every week by about 20%. So pretty manageable, right? I mean, if you're doing 10 minutes the first week, you're going to do 12 minutes the second week and on from there. So for most people that are sedentary, I usually recommend low to moderate intensity to start. So that's walking, swimming, Tai Chi, something that's not, heavy weightlifting or any of that stuff. But that said, weight-bearing exercises are really important when we're going through treatment to strengthen bones, to take care of any bone loss that's caused by chemotherapy. But that doesn't have to mean lifting weights. That can be our own body weight, where we're just holding a plank or doing something like that. Interestingly, yoga is probably the most rigorously validated intervention for fatigue in oncology. And we were talking to Lee before this, and Lee said, I didn't put yoga in the title of your talk because as soon as you say yoga, people are out of there because they're like, I am not doing eagle pose or a handstand. Like I can't, that's way beyond me. And so it can be kind of intimidating, but interestingly, and I should also say, I had never taken a yoga class before I met my wife, and I was super intimidated about it. And it definitely is challenging. It's a good workout, but yoga can be done by anyone with any fitness level. We do yoga on site at Lurie at the cancer center where I work, and when we have our yoga teacher come in there, probably 25% of the people that are in the yoga class are in wheelchairs. So you can do it when you're at any, if you have any physical limitation, if you have injuries, if you don't have a high tolerance for exercise, as it were, you can modify the poses. You can use a selection of props. There's a lot of ways that you can exercise. I got asked a question a little while ago that I didn't know the answer to, so I did a little research into it. But somebody asked about massage and acupuncture for treating fatigue. So I looked into it. There is a little bit of research that suggests that maybe those things are helpful, but I wouldn't say enough to really call it and say definitively, yes, acupuncture or massage works. But I also always say if we ever got rid of acupuncture and massage at our cancer center, I think we would have a patient rebellion. So the people that like acupuncture and massage and find it beneficial really find it beneficial. So maybe something to look into for you. So we'll answer questions at the end, but let me give you over to my lovely wife, Jenny, who's going to get us moving a little bit and just show us some kind of gentle ways of moving.
Can y'all hear me? Can you hear me? We will move a little bit. I don't want to terrify anybody. Just a little bit of movement. But before we do, I just wanted to offer you some tips for building a movement practice in your own life. One thing I wanted to say is that any movement, any exercise will charge up your endorphins, give you a little adrenaline kick, make you feel better. So I have very little patience for people who say, running is better than CrossFit and CrossFit is better than yoga, anything. If you like to do it, do it. If it's something you're willing to do, I will co-sign that all day. And Dr. Pearman talked a bit about the relationship between exercise and fatigue. And one of the analogies I use, if you've ever had a dog, especially a puppy, and they get the zoomies, right? Dogs know when they haven't burnt off all of their energy for the day. And so that's why it tends to happen kind of late at night when everybody's ready to go to bed, and then the dogs start zipping around the house because they know they need to run their little motors out. You got to run your little motor out. So that's why I think fatigue it's kind of this like cyclical thing. And especially with regards to insomnia, if you've been tired all day and you feel really sluggish, and then you're like, I'm so tired, and you go to bed and you can't sleep. Maybe that's because you didn't run your little motor out. And then it becomes this kind of spiraling proposition. The less exercise you get, the more fatigued you are, the worse your sleep habits are, et cetera, et cetera. So it's in terms of fitness or movement, fitness pizza in my mouth. I'm a big fan of fitness snacks. We talked about 30 minutes. All of the experts would agree that 30 minutes doesn't all have to happen at the same time. So some little fitness snacks that I love are a one-song dance party. That's an instant serotonin boost. A typical pop song is 3 to 4 minutes long. You can stand up and dance for 3 to 4 minutes. I know that you can. Squats while you brush your teeth. Planks are great. Butt clenches while you're sitting at a stoplight. If you watch TV or if you have a streaming service with ads, those ad breaks are typically 1 to 2 minutes, about 90 seconds long. You can stand up and do lunges for 90 seconds. So just get up and move a little bit at a time will make you feel better. And movement begets more movement. We all know that, right? An object in motion tends to stay in motion. So if you get up and dance for one pop song, maybe you'll dance for a second pop song. Keep going and keep going and keep going. And then in terms of you getting up to move, and especially with regards to yoga, one of our kind of principles for yoga, if you're like, I don't know what this is and I don't know what to do, the first thing is that it's connected to your breath. Just breathe. Start there. Close your eyes. Listen to your breath. Check in with yourself. We'll do this in a second. And then the other thing, once we start moving, you want to move your spine in every direction it is able to move in. And there are six of those. So forward folds, back bends, twist right, twist left, side bend right, side bend left. So whatever you're doing, if you're doing 5 minutes of yoga, just make sure you move through those all 6 directions in the spine. It's nice to get your hips and shoulders moving through their range of motion. And standing balances with support, if necessary, are great. We tend to lose balance as we age. So I try to incorporate a little bit of standing balance in every yoga practice and every movement practice. What else do I want to say? And then we'll get moving. YouTube is a great resource. As Dr. Pearman said, make sure you clear any new movement practice with your medical team, but YouTube is great. There's great stuff on there and it's free. There's some stuff on there that isn't so great. And so it takes a little time to kind of work your way through the algorithm to find people on YouTube that you like. And we talked about weight-bearing exercise. Resistance bands are great. You can order them on Amazon. It's a great way to get some resistance training, but they're light, they're packable. You can take them with you when you travel, and there are lots of things you can do with those. Do I want to say anything else? Okay, so I know my friends here in the room, you have these rolly chairs and they have arms. So that's a little challenging. So just be mindful. I'll have everybody kind of spread out a little bit. So you have some room. We have a nice big room in here. So if you have enough room for like a full wingspan, that's a good measure. And then some of this stuff we'll improvise a little bit. So let's start before now we've tested our wingspan. Perfect. Let's take a little quick rest. Close your eyes for a moment. Deepen your inhales and exhales. We want to notice without judging. This is an assessment, not a judgment. How are you feeling today? How are you breathing today? What's showing up for you? You can just acknowledge it without judging it. And for yoga, I like to set an intention for your practice, connect it to something maybe a little larger, or even a small little seed, a little intention that you're planting that could grow into something bigger. And as you have that intention clear in your mind's eye, let's take 3 deep breaths in through the nose. Open mouth, exhale. 2 more times, deep breath in through the nose. Open mouth, exhale. 1 more, inhale. Open mouth, exhale. Good. You can breathe in and out through the nose to the best of your ability. If you feel a little congested, don't overthink it. And then we'll slowly blink your eyes open. Sit forward a little bit on your chair so you have a little space behind you. You can keep your hands on your knees. We'll start with a little spinal warm-up called cat-cow. Inhale, arch, lift your tailbone, lift your chin, send your rib cage forward. Exhale, round your spine. Let's do that a few more times. Every breath you take, you might find you access a little more range of motion. Inhale, arch. Exhale, round. Let's do 1 more. Inhale. Exhale. Good. Come back to your neutral spine. Roll out the shoulders. So that was a forward bend, back bend, right? We've already done that. Check those off our list. Let's do some arm movements here. Inhale, reach up. Exhale, arms down. Inhale, reach. Exhale, lower down. Inhales bring us into more expansive shapes. So whenever you're taking up more space, growing taller or longer, that's an inhale. Exhales help us get a little smaller. Let's do 2 more. Inhale. Exhale. 1 more. Inhale. Exhale, arms down. Let's inhale, reach your arms up. We're gonna make little goalposts with your arms. So as you exhale, pull your elbows wide by your shoulders. Inhale, reach up. Good. Finding a little back bend here as you pull your elbows wide. Inhale, reach, opening across the chest and feeling a little strength building in your upper back. When we sit a lot, we tend to get weak and tight in the chest and weak and a little too loose in the upper back. So let's pull those elbows wide. We're just going to kind of flap your wings here. Keep your neck nice and long and press your forearms back. Press back, press back, press back. Good for 4, 3, 2. We'll do a little bit of a larger motion here. Exhale, close your elbows together. You can kind of come into that little round spine again. Inhale, open up to a back bend. Good. Let's do 3 more of those. Exhale. Inhale. Nice. Are we feeling better already or what? I'm like wide awake. Open up. Good. Let's do 1 more. Exhale. Inhale. Open. Beautiful. Release your arms down. Roll your shoulders. Wow. Good. So it's easy to kind of in a seated position build some strength. If you touch your shoulders, if you have sleeves on, maybe you can't feel, but your arms should feel warm a little bit, right? That's increased blood flow. We just did that. So let's try to get into our legs a little bit. Feet are planted on the mat, parallel, about hip width apart. Let's start just with a little butt clench. Can you just squeeze your butt cheeks until you lift like half an inch off of your seat? Good. And release. Awesome. A little butt clench. Good. I can see it. I can see it all popping up. That's nice. Good. 2 more. And release. 1 more. Nice. Awesome. So a little strength. Again, you can do that at a stoplight. And then we can take our hands to our heart. Maybe reach your arms up overhead. It's a little more challenging. We're going to do a little chair pose lift. You don't have to come all the way up, but can you shift the weight into your feet, lift your hips 1 inch off the chair, and then sit back down. Now you can sort of pretend to do this. So I'm lifting my butt all the way off the chair, but you don't have to come all the way up. You can move as if you're coming off that chair, and you should still feel a little bit of muscular engagement there, a little effort. If it's too challenging to keep your arms up by your ears, let's bring those hands down to your heart. Lift and down. Good. 1 more little lift and down. Awesome. Roll the shoulders out. Let's stack your arms. Call these I Dream of Jeannie arms. We're going to do a little twist. I'm going to try to mirror you, but my brain's real dumb. So let's see how it goes. Exhale, twist to the right. Inhale back to center, and exhale, twist left. Try to keep your hips grounded so that you're really isolating this movement to your spine, so you're not shifting around too much, even if that means it feels like a shallower twist because you're not moving through the pelvis. Exhale. This is what we would call an active range of motion. We'll do more of a passive range a little bit later. Good. Let's come to the left. 1 more time. Roll out the shoulders. Take a deep breath in. Reach up. Interlace your fingers. Flip your palms up. Ground down through your hips. So you're not going to tip all the way over, but let's take a side bend to the right. Keep that left butt cheek connected to the mat so you don't spill over. You're lifting up and over. Inhale, reach back up. Exhale, let's take that to the left. Good. Inhale, reach up. Sweep your arms down by your sides. And if you can hold on to your seat, if you can kind of thread your arm through that armrest or however that works for you, hold on to your seat with your left hand, and then let's tip over to the right. You can kind of turn your chin towards the floor. You might feel a little stretch in your neck. You can dip your chin towards your collarbone. Lean your ear to your shoulder. Good. And then roll your chin back down to the midline. Come up through center. We'll do that on the other side. So hold on with your right hand and lean over to the left. You can kind of bobble your head around and find where a little stretch in your neck might show up for you. Excellent work, friends. Roll out the shoulders. I don't think you'll be able to do this in your chairs, but for our friends who are watching from home, we'll try a little warrior 2. So I'm going to slide off to the left, to my right. So let's pretend this is my right leg. I'm going to sweep this leg around. So I'm basically only sitting on my right thigh. Yeah, awesome. And you can plant that whole left foot on the mat. So spin your toes towards me, yes, and press the whole sole of your foot down. Awesome. Inhale, reach your arms up. Good. So this is warrior 2. If you've been to any yoga class, you've probably done this. We can take a little reverse warrior, which is left hand to left hip, right arm up and back. Nice. Y'all are making it work with these chairs. I'm impressed. And then let's bring your right forearm to your right thigh and reach your left arm up over your ear. You can hold this nice big long reach, or you can make some little arm circles here, 2 or 3 in each direction. Excellent, friends. Good. And then we'll windmill back up. So this is, we talked about working through the range of motion in the hips and the shoulders. We're doing that here. And then we'll reset to the other side. So slide that left thigh onto the chair. Those left toes aim straight ahead. Your right foot is flat. Sorry, every time I turn my chin, I get a little louder. Sorry about that. Arms long. My husband was talking about the first time he took a yoga class was when we were dating. He and his friend, he's like traumatized by warrior 2. He and his friend were the only 2 men in class. That ratio has really strengthened in the years since. But all the women in class come into warrior two like this. And after 2 seconds, Tim Pearman and his friend went, ow, I can't hold my arms up by my sides. These guys are doing push-ups and biceps curls all day. Let's reach back. I say that as an assessment, not a judgment. And then let's take your side angle form to thigh. You can stay in this nice long reach, or you can add a little movement to that, some circles, 2 or 3 in each direction. Excellent work. Awesome. Then we'll come up to center. We're going to do a couple more hip openers. And then if you feel comfortable standing up, we'll do a little standing balance. So let's keep your left foot planted on the mat. Flex your right foot, cross your right ankle over your knee. We want to keep this foot flexed to help stabilize the ligaments in your knees. And your knee might kind of hike up a little bit, and that's fine. We want to try to gently guide it towards the floor. So you have this kind of little triangle shape. Sit up nice and tall, tallest spine, and then maybe you start to tip forward. So we're not rounding the spine, you're kind of lifting forward and up. Inhale, come back up to center. Let's switch the cross of your legs. This is a seated pigeon. Flex that left foot, ankle over knee, little triangle shape here. Inhale. Exhale, or figure 4, sometimes they call this. And then come on up. Now, if you feel comfortable, we'll come up to stand. If you don't want to stand up, you can repeat that little pigeon, that figure 4 on the right and left. But if you feel comfortable, let's stand up. I promise not for long. We'll sit down soon. You have those rolly chairs, so be mindful. But we're just going to try a little balance here. So you can hold on. We'll stand on your left foot first. Let's come to the toes of your right foot and then turn that right knee out to the right. We're going to plant your sole of your foot on your ankle so you can have a little kickstand here. If you feel brave, you can slide that foot up a little higher. Yep, anywhere along the length of the leg, truly anywhere. You can hold on to your chair. You can bring one hand to your heart. Maybe you reach that arm up. Maybe you come to like one little fingertip on that chair. Helps to keep your eyes focused. Maybe reach both arms up or both hands together at your heart. Y'all look beautiful. Beautiful little forest of yoga trees. Awesome. Let's come on out. Shake out the legs. Good. I'm going to come over to the other side. So standing on your right foot this time. Right hand supporting the chair. Open that left knee to the left. You can start with those toes on the floor. You can slide up a little higher, a little higher. You'll feel your glutes activate to externally rotate that leg. One hand to heart. Maybe one hand to ceiling. Maybe one little finger on that chair. Yeah, little by little. Keep breathing. Awesome. Inhale. Exhale. Come on down. That was amazing. Beautiful work, friends. All right, let's take a seat. We talked about this being an active range of motion. You're just using your core strength to initiate that twist. You're not using any external forces. Again, this will be a little more challenging for you in those chairs with arms, but for my friends at home, if you're in an armless chair, we're going to turn to the right. So the back of your chair is like right by your right arm. Yeah, you can kind of negotiate this however you're able. Inhale, reach up, grow tall. As you exhale, you're going to turn to the right and you'll hold on to the back of the chair with both hands. So one hand to one side, one hand to the other. Sit up nice and tall. Every inhale, we grow a little taller. Every exhale, you might find a little more twist, but try to keep your pelvis really grounded so you're not kind of swiveling out of your chair. Inhale to grow taller. Exhale to twist. So now maybe we can find a little bit of a deeper twist because this is more of a passive range of motion. You're holding on to that chair to give you a little leverage. And then we'll come around to center and to the other side. Come around, come around, come around, come around. Inhale, reach up. Exhale, twist, framing the back of the chair with your hands and using that for leverage, but keep your pelvis grounded. Every inhale, we grow a little taller. Maybe every exhale, you can get like one more little 1/4 of an inch of twist. Come back to center. Awesome. Shake out the legs. One thing I forgot to mention, we're going to do a couple of little forward folds here. So let's send, you can scooch forward on your chair if you need to. Send your right leg forward. Inhale, grow tall. Exhale, you can bring your hands to your left thigh. Keep your spine tall as you tip forward over that leg. When we were talking earlier, I wanted to mention that back bends are energizing. Forward folds are pacifying, they're relaxing. So if you're doing yoga in the morning, maybe you do some more back bends. If you're doing yoga in the evenings, you do more forward folds. Let's come on up and switch sides, plant that right foot. And the reason for that is not just yoga science. There's like a Venn diagram of yoga science and science, and sometimes they overlap and sometimes they're sort of in their own little areas. But if you think about it, if you were on the losing end of a bar fight, what would you do? You curl up in a little fetal position on the floor, right? You protect your vital organs, you protect your viscera. So when you are in a back bend, you literally have a visceral reaction because your viscera are exposed. Your saber-toothed tiger is chasing you. You're not going to be like, I think I can defeat him. You're going to curl up, right? So we have a visceral reaction to, and also there's a physical stimulation of your adrenal glands when you come into back bends. So something to keep in mind. Early mornings, middays, back bends forever. Evenings, forward folds. And we'll take a forward fold now. So inhale, reach up. Exhale. You can round your spine a little bit here. You might even wrap your arms underneath your thighs. And you can drape your chest, your torso over your legs. When you breathe in this position, you can feel your belly kind of expanding into your thighs. And you can also feel your back expanding. As we inhale, we expand. The rib cage widens, the belly releases into the thighs. And as you exhale, you drop a little bit closer to the floor. Excellent work, friends. And then to help you get out of this position, you can bring your hands to your thighs, roll your spine up slowly and easily, roll your shoulders out at the top. We're going to take a very, very brief Shavasana. So settle into any comfortable position on your chair. You can relax back. We'll close your eyes. You can rest your palms on your thighs or on the arms of your chair. You can rest in there. Palms can be face down or face up. Face down. Tend to think of that as a little more grounding. Face up, more of a gesture of receiving. We'll just close our eyes for a moment. You can let the breath, the heart rate slow down. You don't even have to think about your breath anymore. Settle into stillness. And then we'll deepen our inhales and exhales. Bring your mind back to your breath and therefore back into your body. Recall your intention one more time. So all together, take one deep breath in through the nose. And open mouth, exhale. Good. Breathe in and out through the nose. And let your eyes blink open. Beautiful work, yogis. Thank you for practicing with me. Thank you for sharing your time and your energy with me. I think we're happy to take questions now, right? Okay, great. Oh, thanks. Thank you. Should we come over here?
Sure.
Questions?
Yeah, thanks, everybody. And guess what? You just did yoga. Congratulations. Yes.
You mentioned bright light, but you didn't mention blue light as a negative.
Yeah, that's a really good point. So there hasn't been much research on blue light, but definitely there's been a lot of chatter about it. And red light as well. So you can also buy red light lamps, and some people swear by those to actually help with sleep.
Before bed?
Yeah, before bed. So, I don't know, but me.
That's the common knowledge or common whatever you want to call it, the scuttlebutt, I guess.
Yeah, for sure.
Hi, this is more of a comment than a question, but what I'm finding as dealing with two things, one is age and one is illness, is that less intensity and more time is fruitful.
I agree with you wholeheartedly. I think you would too. Yeah.
Yeah, I do agree with that. The two kind of factors for exercise are intensity and duration. And if you can't do one, you can do the other. Famously, if you've heard of Tabata, Tabata is a 4-minute workout, 4 minutes, 20 seconds all out, 10-second recovery, 20-10, 20-10, 4 times through that circuit. Sounds amazing to get your whole workout in 4 minutes, but you have to like go hard. So a 45-minute walk is another way if you're thinking about calories burned, which I don't really like to talk about too much, but if you think about the heart rate recovery of a Tabata versus a 45-minute walk, 45-minute walk might be a lot more pleasant. So yeah, intensity and duration, you can kind of slide those dials in any direction. It's a great comment.
I think you also bring up a really interesting point about age happening at the same time as treatment.
Right.
Because I see a lot of people that come in at the beginning of their treatment, and by the end of the treatment, they, it may be a year later. I mean, like, some of the treatments last forever, or they, can feel like forever. I think I see a lot of people that kind of get down on themselves, like, oh, there's no way, like my workout is just shot because of treatment. But what they don't realize is you've also gotten a year older, or 2 years older, or 3 years older, and so we aging definitely does affect our tolerance, our weight bearing ability, all of those things. So I think that's a really good point to just keep that in mind, that it's not just treatment. You're also getting older. We all are.
Which is all the more reason to start now, start moving now, lay that ground. It's like an investment, the sooner you start, the more you've kind of put in the bank for later.
Just the word of something that we've done is that Worth and I, there will sometimes be one of us awake at night and one the other. And thinking about lights, we've got headlamps that shine red. And when you use that, you can see what you're doing without waking up your partner and without suppressing your melatonin the way that white light does. It's just a really handy thing to have around. It's a headlamp with red on it.
That's awesome.
Red
Really
light.
cool.
Yeah. I need one of those.
That's a good idea.
So good when they're in the blinking function.
Getting pulled over, having nightmares about that.
Jenny, I know you're located here in Chicago, so if anyone wanted to get in touch with you or participate in some of your classes
Yeah.
in person, how would someone get in touch with you? And do you do anything virtual? So for everyone else that's kind of watching that's not based in here, is there a way that they can get connected and, get some more about things that they can do at home, in a chair, or general types of things to keep people moving to help with that fatigue that they may be experiencing?
Yeah. Thank you. Thank you for being my promoter. This is my name, Jenny.
Totally unsolicited, I promise.
My agent. My name is Jenny Finkle, and my website is jennyfinkleyoga.com. So pretty easy, jennyfinkleyoga.com. I do work at studios here in Chicago. I'm at Studio 3 and at East Bank Club. And I do private sessions. I do private sessions via FaceTime for people who I have a couple of clients who travel a lot, and I have one who's got a small baby, a small toddler with another on the way. And so FaceTime is a little bit easier. I'm not currently doing any virtual class offerings. I think part of that is that once we got through COVID, I never wanted to teach into a laptop screen again. Get the ring light out and rearrange the furniture. So for private sessions, I do that virtually, but currently I don't have any. But I will say, I do have a couple like random little videos on YouTube, but YouTube is a fantastic resource. There are chair yoga classes on YouTube. I mentioned a One Song Dance Party. There's a person I follow on YouTube. Her handle is MadFit, think her name is Maddie. So MadFit is like the play, but she has one song choreographed dance videos, like one song dance cardio. So there's a lot of like good resources on YouTube. And again, you kind of have to wade through the muck a little bit too. You'll find some that you're like not that into. Takes a while to dial it down, but good stuff there.
Thank you. And Jenny, we had a question online that says, are there any exercises someone can do for neuropathy?
Oh, yeah. So neuropathy, of course, is like kind of a loss of sensation in your feet. And what I would recommend for neuropathy, standing balances would probably help. Make sure that you have a support, have that chair, a piece of furniture or something. And then I would recommend maybe a little rolling your foot on a ball or on a little rolling device to try to just stimulate a little bit of blood flow to that area. Those would be my kind of recommendations. I'm sure your physician has probably given you some tips for that, but like deep massage can help, deep tissue massage, rolling your feet. I'm a big fan of toe spreaders, like even just they sell them for like $50, but you can also just buy pedicure toe separators for $2, which I would recommend. And just kind of putting those in between your toes while you're cooking dinner or watching TV. It's a nice way to kind of stretch out the soles of the feet. It's a great question. I should do more research about that. Yeah. I have a question over here.
I don't know if anybody's heard of yoga with Adrienne, but she's somebody who kind of got us through the first month or so of all of this. And our daughter actually recommended it because she usually has like a January 1 to January 30th program to follow. Just 30 days and kind of a challenge if if you've never done it before or you need some consistency. It was kind of a nice way to tune in together 15, 20, 25-minute sessions. And she has multiple different videos out there that are available. And she does have a lot of the 30-day. So we've just kind of said, you know what, this 30-day thing works.
Yeah. Yeah.
Somebody telling me we're doing session 3 today, Doris. Okay. So that really works for us. And it is a great way to start the day psychologically and physically.
Yoga with Adrienne, she was, I think, a real pioneer of YouTube yoga. She's sort of one of the originals and kind of showed what's possible. There's another teacher on YouTube that I love. Her name is Charlie Follows. Charlie Follows. She's British, so her accent is lovely. It's like doing yoga to a Merchant Ivory film. But she films in really beautiful locations. She's really, I think she started out in her basement, like most of us do, but now she's found these beautiful locations, sometimes beaches, forests, villas, and she does a lot of the monthly challenge. She had one in June. I think she probably usually does one in January as well. So Charlie Follows is another great follow, no pun intended. But yeah, Yoga with Adrienne. There are a lot of them who are great.
Thank you so much, Dr. Pearman and Jenny, for sharing your time and expertise with us today.
Thanks for having us.
Thank you, friend.